Welcome, everyone. We're just checking if we're live on all platforms. Today is World Heart Day, and we are here talking to Dr. Asha Mahilmaran on heart failure with preserved ejection fraction and its linkages to anemia. Heart failure is a condition that is rarely spoken about. It's frequently mistaken with other heart conditions as well, as we found as through the series. And so Patients Engage has partnered with Boehringer Ingelheim as part of the Big Heart series to build awareness and educate people on this condition. We are very privileged to have with us today Dr. Asha Mahilmaran, who is interventional cardiologist and cardiologist senior consultant at Apollo Hospital, Greams Road, Chennai. As always, our intent at Patients Engage is to make sure that people are better informed and they proactively manage their own health and feel confident about managing the day-to-day decisions. And there's a slight error in that. So we're talking today on anemia and heart failure. And as part of the previous part of the series, we have spoken to a few other doctors on various topics: gender disparity, aging, hypertension, and linkages to HFpEF as well as COPD. Quick guidance to our audience that the views expressed are of the physician and only intended to spread general awareness. They do not replace a medical consultation. So please do reach out to a doctor for specific medical issues. And, as always, you can reach out to us through our Facebook, Twitter, Instagram, YouTube and LinkedIn channels, as well as on our website, www.patientsengage.com. So let's get started. As I said, we have with us Dr. Asha, who is a very senior person. Thank you, Dr. Asha, for joining us today. Let's start with the basics. As I said, often people confuse heart failure with a heart attack or a cardiac arrest. And it's, because colloquially, at least in the some of the languages, they say things like, his heart failed or her heart failed. And actually it could mean a heart attack or a cardiac arrest. So if you can explain what is heart failure and how is it different from a heart attack?
First of all, my greetings on World Heart Day. The World Heart Day falls on September 29th of every year. And this year's theme is use your heart to help every heart. And this is one of our initiatives to try and help the heart of others. And as rightly put by Aparna, colloquially, a lot of confusion occurs. Heart attack is more understood and common term, whereas heart failure is looked at as the heart has collapsed and with a lot of fear. Heart failure, basically, it means that the heart is unable to cope up with its demands. The heart failure can be very mild. That is, the person is only having some mild symptoms, some mild discomfort or differences in day-to-day life. So that's called as a functional class 1. So only when they climb uphill, when they go on a trek, they may feel a little bit of breathlessness or discomfort. So it can be as mild as that, or it can progressively increase in its functional class to 2 when you're unable to do your day-to-day activities without any difficulty, like even walking 1 kilometer or 2 kilometers to a bus stop becomes difficult. Then comes the class 3, when you're finding it difficult even to move within your house. And finally, the extremes of heart failure, which is called as a stage 4, where you're having difficulty in self-care activities. That is, even bathing, you're going to the toilet, all becomes difficult. You need assistance. So heart failure basically means you're finding it difficult to cope up with your work. The heart is finding it difficult to cope up with the work. And it can be very mild to very severe. And that is classified by the functional class called the New York Heart Association class. It varies from class 1 to class 4.
Right, right. And there is this term that we are using, heart failure preserved ejection fraction. Is that, kind of synonymous with heart failure, or are there multiple types? And, how does, and is that commonly diagnosed?
Yes. First of all, I would like to tell that heart failure is of two major types. One is called as heart failure reduced ejection fraction. The other is called as heart failure preserved ejection fraction. In medical terms, we also bring in something called as heart failure mildly reduced ejection fraction. Basically, heart's pumping efficiency is measured.
Doctor, can you hold the mic closer slightly, because it's fading slightly?
Yeah, the heart failure is measured by the efficiency, the pumping efficiency of the heart. And that is given by ejection fraction, a value, which is calculated based on the heart diameters in when they pump and when they relax. So based on this, we calculate what is called as an ejection fraction. The normal ejection fraction is about 60 to 80%. When it is decreased below 50%, it is called as heart failure reduced ejection fraction. And when the heart is pumping, capacity is all right, but still it is unable to cope up with day-to-day activities. That is, the ejection fraction is more than 50%, but still you have symptoms of breathlessness and the heart is failing. That is called as heart failure preserved ejection fraction. In today's presentation of heart failure, less than 50% is heart failure reduced ejection fraction, and more than 50% of patients present with heart failure preserved ejection fraction. Very often people think that only the pumping efficiency goes down, there can be failure. That is not true. Even when the patient's pumping efficiency is all right, there are multiple other causes which produce the heart to strain itself and become incapable of coping up with day-to-day activities. We will be discussing further on this.
Right. Thank you. And you said more than 50% of the heart failure tends to be preserved ejection fraction. What are the warning symptoms and signs that people should be aware of?
Basically, this heart failure preserved ejection fraction is more common in patients who have other diseases like blood pressure, diabetes. As age advances, it becomes more common.
Right.
People with heart irregularities, irregular beatings, they have more commonly. And also patients who are obese and physically inactive. These are some of the major contributors to this type of heart failure. So people who have some of the background diseases and who find it difficult to move, as I said, if you're finding it difficult to carry on with activities which you used to do comfortably a year back or 2 years back, don't say that it is because of my age. Try to find out what is happening to you. And definitely that will go a long way in helping you out.
Right. So one of the things that we found when we've spoken to people is, especially women, right, are so used to having things like varicose veins, pain in the legs, or swollen feet, etc., that they completely ignore some of these signs. Do you see that as well in, in your practice?
Absolutely. So when you have a breathlessness, a problem to breathe when you're doing a particular work, and you begin to develop some swelling on your legs, you gain weight suddenly, and you start to have some cough when you're lying down, and you're uncomfortable in the night lying down, or you get up in the middle of the night coughing. These are some of the symptoms of heart failure. And do not ignore these symptoms. And this swelling of the legs can be due to multiple causes. It can be due to anemia. It can be due to kidney failure. It can be due to prolonged sitting or standing, or it can be due to some drugs. But when you have these swelling of leg, along with the breathing difficulty, it is more likely to be heart failure. So better to approach the doctor and find out what exactly is the cause of the swelling of legs, rather than taking it for granted it's because you're sitting for a long time and it may be just part of normal aging. It's always better to seek help and advice.
Right, right. So you mentioned anemia as well, and since we want to drill down a little bit on that. So does heart failure, especially preserved ejection fraction and anemia, do they go hand in hand? Is there a connection? Is there a cause and effect? Or they just comorbidities? How does that, if you can explain that to our audience?
Yeah, anemia is an important comorbidity, and it definitely makes an impact on the prognosis of patients with heart failure, both reduced ejection fraction and preserved ejection fraction. But the percentage of patients with anemia is much higher in the heart failure preserved ejection fraction. In studies, they have shown that as much as 60%, that is more than 1 and 2, with heart failure preserved ejection fraction is likely to be anemic, whereas 1 and 3 with heart failure reduced ejection fraction is likely to have anemia. And if these patients with anemia seem to have higher death rates rather than patients without anemia, and correction of these anemia with intravenous iron injections when there is a documented iron deficiency seems to improve outcomes. It improves the quality of life. It improves their energy level, ability to do their day-to-day work, and also decreases the hospitalization rates due to heart failure.
Right. So what you are saying is that if you manage the anemia, which is a comorbidity, which may be a comorbidity of heart failure, it not only improves the quality of life that you are living, but it also improves the outcomes and the prognosis of the person.
Yes.
So apart from, since we are talking of appropriate management, I know you mentioned IV. Is that the standard of care for anemia when it's accompanying patients with heart failure?
Yes, people don't like injections in general. And doctors are not very keen on giving injections unless otherwise it's really needed. There have been studies which tried oral iron therapy along with intravenous iron therapy, and it was found that oral iron therapy was not effective, and it was only the intravenous iron therapy in heart failure was effective in improving the anemic symptoms and the mortality. This may be because there's a lot of fluid overload in heart failure. So even your gut wall has a lot of fluid lining it. So if you give it as an oral iron, the absorption is not adequate in heart failure patients. And this may be one of the reasons why the oral iron has not been found to be beneficial. And it's an intravenous iron preparations are available. And these are found to be the only forms of therapy which are beneficial and proven value in heart failure.
Right. And does, I mean, in general, in India, anemia among women is quite high. I forget the numbers, but it's fairly high numbers. But does that also show up? I mean, typically once women get past their menopause, kind of anemia levels drop a little bit. But in terms of patients with heart failure, do you still see, different proportions of women with anemia and heart failure as opposed to men?
Yeah, in general, anemia is much more common in women, and especially because of the culture in India, especially in the rural households and in many traditional house, it is always the woman who has the meals last.
Right.
And when she comes to eat, there are very little vegetables or meat or fish available for her. So she would most of the time eat only the rice and the gravy, and which does not contain enough iron content, and it's just carbohydrate content. And this contributes to a lot of anemia in general in the women, and heart failure in preserved ejection fraction, especially, it's a big problem. As it is, the heart failure preserved ejection fraction is more common in women, and anemia, the significantly higher percentage of anemia in women adds on to the malady.
Right. And does that also result, and this is a question I think that has come up from somebody in the previous session, is that one of the contributory factors for heart failure being diagnosed earlier in women? Is there any such linkages?
Yes, if there is a significant amount of anemia and patient is becoming more symptomatic, it may bring to the notice of the doctor earlier.
Okay.
And
Right.
this might be true.
Right. And one question that's come up, so is it only, anemia can also show up as other heart conditions, or is it typically associated with heart failure?
Yes, anemia is a big problem with heart failure, but yes, it contributes even to coronary artery disease, morbidity and mortality,
Right.
and also other conditions like hypertension, diabetes. In every format, it adds on to the burden.
Right. So in terms of, screening for people of, routine health checkups, I know that typically most people start around the age of 40, or, sometimes we are not even regular with that. And I think, again, I don't know if there's a gender difference. I don't know if it's studied, but I think the general perception we get is that men go more regularly for checkups than women, but not quite sure about the studies on that. But what is your advice for people as far as screening is concerned, and when should they be screening for? Because especially, we are a country where diabetes is increasing, hypertension is increasing, and at younger and younger ages. So what is your advice for people on as far as that's
I
concerned?
think the screening should start at the school level. So actually, we have seen studies have shown that the pre-diabetic stage, pre-hypertensive stages, and the obesity incidence is increasing even in the school population. So school is one of the times when we can start using, like our secondary school onwards, we can start screening for these risk factors, and inappropriate lifestyle can be detected early and corrected. And a definite health checkup should be started at least at the age of 20. You may not do it very frequently when you're in your 20s. You can do it once in 3 years or so. And once you reach 30, you can do it once in 2 years. But after you reach the age of 35, at least once a year should be strongly recommended.
Right. And do you find in your experience as well, and your research, that people who've had either gestational diabetes, or they've had um, hypertension during pregnancy, are they at greater risk of heart failure? Women,
I
obviously.
must congratulate you, Aparna, for bringing up this question. This is such a wonderful question, and I'm really glad that you have brought it up. So pregnancy is called a window to future cardiovascular health. And it's often considered a missed opportunity. So if a pregnant female, it's like a stress test. So if a pregnancy time, a female develops a gestational diabetes mellitus, a hypertension, or any adverse pregnancy outcomes. We call it as APO, or adverse pregnancy outcomes. Adverse pregnancy outcomes include abortions, includes a small for babies, a preterm baby, intrauterine death, or neonatal death. Everything is considered as an adverse pregnancy outcome.
Right.
So anybody who's had an adverse pregnancy outcome, when they were followed up in future, it was found that they were having 2 to 3-fold higher risk of developing diabetes, developing hypertension, and higher risk of cardiovascular disease.
Right.
So these patients should use that opportunity. If they have things, they should be on a much more regular follow-up try to correct their lifestyle, and whenever required, take medications as well.
Right, right. No, I think because we found that, especially for diabetes, we found with quite a few women who found that, they had gestational diabetes, but they didn't take it seriously, or, and soon after that, they got diabetes. And we also found that with some of the eye conditions, like glaucoma and retinopathy. In terms of, because we're talking of anemia, we're talking of heart failure, its linkages to things like hypertension, diabetes. Any advice for people so that they can prevent getting heart failure? And then later we'll talk of management of heart failure in terms of lifestyle.
So heart failure is a culmination of diseases which led to the heart disease in the first place. So to prevent heart disease, you have to, first of all, eat healthy, exercise regularly, maintain optimal body mass index. That is very important. And this itself will prevent other complications like hypertension, diabetes. But if you're genetically prone, and if you do develop diabetes and hypertension, start early. That is very, very important. Starting the treatment early and staying with the treatment lifelong. And lipid disorders, whenever you have a diabetes or blood pressure, it's not important only to treat the diabetes or blood pressure. It's very important to treat your cholesterol abnormalities, which are the killer finally in form of coronary artery disease. So lipid abnormalities, if they're not corrected in sync with diabetes management and hypertension management, can lead on to multiple troubles. And once you've had a heart attack, it's very important to know what's your heart pumping function, and also to make appropriate changes in your lifestyle, control your sugars, blood pressure, and take the lipid medications, the statin drugs, along with the blood thinners lifelong. So I would like to re-emphasize that you have to treat these therapies lifelong. Many people think that after a heart attack, 2 or 3 years, they don't have a second problem. They think they are in the safe zone and it is okay to leave the tablets. But a heart disease is not a static or a one-time event. It is an ongoing process. So unless you can keep it in check or control, it is likely to progress over time, albeit slowly. So just because it's a slow progression, you tend to have a kind of a
you get complacent.
Complacent that it's okay and I'm doing fine. Why take medicines? That is a very, very wrong statement or feeling, and it can catch up with you even after 10 years or 20 years in a bigger fashion. So please avoid progression of the disease by staying on with your drugs regularly, with your lifestyle changes and regular exercise and diet.
And once you've been diagnosed with heart failure, then what are the lifestyle, habits and changes in diet that you should follow?
One of the very important things which you need to do is try to reduce your body weight. So feeling lighter makes it lighter for your heart to handle it as well. So try to reduce your weight. And it's not that if you're having a heart failure, my heart has failed, so I have to keep it under rest, and you don't walk, you don't exercise, you gain weight. Actually, your outcomes are going to worsen. So exercise should be done in accordance with the advice by your doctor. Accordance with the doctor, how much of exercise you can take and your body can take at that particular level of your heart failure. You should sync with your doctor and follow the exercise prescription. And by doing regular healthy exercise, maintaining your body weight, and the other two important factors with any heart failure is reduce the load for the heart. The two important things which load the heart are, one is salt. So limit your salt intake. You don't have to go on a zero salt diet. And currently we've had a recent trial also saying that going too low on the salt may not be very good, but reduction in salt is helpful. And reduce your water intake. So if you take a lot of fluids, the heart only has to pump it. So a failing heart cannot cope up. So reduce your fluid intake to 1 or 1.5 liters per day. The exact amount will be depending on your heart condition, but it is roughly 1 to 1.5 liters of fluid per day, by restricting salt, water, optimizing your diet, controlling your cholesterol, and regular exercise prescription, and following it regularly will definitely help you improve your outcomes in heart failure.
Right. Thank you. Thank you, doctor. I think that was very well explained in terms of, how all of these factors improve the effort that your heart has to put. Think we don't have any other questions that are there. So any final word, today is World Heart Day. So any final words for our audience who are listening?
Yeah.
And
what is very important is heart failure is today much more manageable than earlier years. We have fantastic medications for heart failure. We have understood better heart failure. We know the right approaches and we know how to tackle the comorbidities. So by cooperating with your doctor and understanding and empowering yourself with the knowledge about heart failure, there's no need to panic because of the word of heart failure. Heart failure outcomes can be very excellent, provided you do the right things, follow the right guidelines, and follow it up carefully with your physician. You can continue to lead a very healthy, happy, and heart failure can be improved. There is another division of heart failure, which is called as heart failure improved ejection fraction, which means you can improve your heart failure, the pumping ejection fraction. And once you have improved, the outcomes are much better. So there's a lot of optimism for heart failure patients today, much more than yesteryears. And with the information and empowerment of knowledge, you can tackle heart failure in a better fashion today. And there's no need to be frightened or threatened by the word, but face it with courage.
Right. Thank you. Thank you so much, Dr. Asha. I think, as you said, that we understand heart failure better now. And as you said that, a lot of practical little things, if you do and you focus on reducing salt, reducing, managing your fluid to the level as advised, staying active, and and some of these are across a lot of conditions, but definitely for all heart related issues. So thank you once again, Dr. Asha, and thank you to our audience for listening in today. And as always, if you have any further questions, please do write to us and we will make sure that it is responded to. And I think we also talked a lot about anemia today, so be vigilant about your iron levels and make sure that you get it addressed and do not neglect them, because it's not just it has repercussions or impact on how your quality of life as well. So thank you once again, Dr. Asha, for taking the time and spreading the message of World Heart Day, which is to use your heart to connect with other hearts. So thank you.